Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Thanks so much for joining us on the Think Like a Pancreas podcast. I'm Alicia Downs, an RN here at Integrated Diabetes Services, and I'm here to bring you guys some information today on what I personally find to be one of the hardest aspects of life with diabetes, dealing with insurance. I am known to complain about dealing with my insurance company more than dealing with Lowe's, more than dealing with my pump sites, more than dealing with doctors. I often say that diabetes is a medical diagnosis with a mental health treatment plan. It's a lot about how we think about our life with diabetes and how we mentally deal with it, how we cope with it over the long haul. And nothing in my life with diabetes is as draining as dealing with my insurance company. The pharmacy can be tough, but usually pharmacy issues travel right back to insurance issues. And it can really be victimizing and disempowering because I can do everything right. My A1C can be on point, my blood sugars can be great. But when it feels like the company that I have partnered with to facilitate all that and make it all happen is holding me back, limiting me, cutting my legs out from under me, and sometimes like holding my life hostage, it can be really, really damaging. So I wanted to bring some info for you guys. This is an area of particular specialty of mine here at IDS. It's an area that I hate dealing with, but that means I've kind of weaponized myself and become really good at dealing with it. As a nurse, a big part of nursing is patient advocacy and learning the system and finding ways to make the system work for patients. So that's a big part of what I do at IDS. So if you're struggling in that area, give our staff a call. Sometimes patients will call just to do a consultation to work through their insurance struggles with me, and that's okay if that's what you need. I asked one of my insurance all-stars to join me today. Elizabeth and I worked together a couple of years ago, and this is how amazing she is that she stuck. When I thought insurance struggles, who do I talk to? I immediately thought I need I need to talk to the locomotive of insurance doggedness and determination. I think of all the patients I have worked with over all of the years I've been a nurse, much less a diabetes specialist, Elizabeth has had the most really impressive successes in her pursuits of getting things covered by insurance. So I asked her to join me today, and she was amazing and said, absolutely. Without divulging her age, because I would never do so, I can say that Elizabeth is a Medicare participant. And she reminds me that not everybody's insurance is the same, and not even everyone's Medicare coverage is the same. So the big disclaimer is today that it's not going to be a one size fits all. You can't just copy paste what we're sharing and things like that today. It's more take the ideas, take the concepts, and then apply. What is universal is contract law, and kind of insurance law. The concepts that govern this, at least in the United States, are pretty universal. So while your coverages might not be the same, the concepts of how we can get things covered are pretty much can carry over. So the processes might be a little different, the exact wordings might be a little different, but the ideas are very much the same. So thank you, Elizabeth, for joining us. I'd love to start off kind of why you initially started working with IDS and what kind of drives what kind of fuels your drive in getting things covered by your insurance coverage.
I started working with IDS about 5 years ago. A practitioner in the diabetes clinic where I was seen gave me a little piece of paper one day and it said IDS on it. And she said, take this and see what you find out. So I did, and I thought, wow, this is exactly what I've been looking for. To me, one of the uh, biggest struggles in managing diabetes is finding a provider that uses the devices that we use all the 24/7 and has experience managing the disease. I found that at IDS. Given that I'm a long hauler, I'm working on 62 years with this disease. It's very important to me to have quality of life, and I have quality of life by managing my sickness. And who better can help me manage it than another fellow traveler? That's what I found at IDS. At the time, I had just started using CGM, continuous glucose monitoring, and a new tandem T Slim pump. And I felt like I needed some, you know, support and on managing these devices so that I could get the most out of them. And as Alicia stated, insurance was a big hurdle. I came on board right when Medicare uh, approved paying for continuous glucose monitoring. Because I went on it the day after. Yeah, we were ready to go. It was either July or August of 2017, and uh, anyway, so the and given that it was new for Medicare, the the kinks weren't all worked out with the billing process for having it paid for. I came on board with that, and I learned it was a learning experience not only for me but for I'm sure some of the employees at Medicare.
Yeah, I think you speak to a really good point. That is, we are often traversing fresh paths. We're a rare disease. We make up, as people with type 1, 1% of the population. And by the time we make it to Medicare, and we've got new ways of doing new technologies, telehealth is new. We are looking at needing new ways of learning to use new technologies to treat a rare disease. That means we're kind of the small percentage of the small percentage of the small percentage. So it's going to need new ways of billing, new ways of thinking through a process. And sometimes that means we get a no just because they don't have that process in place yet. And we have to almost be willing to work with the process to build those roads and stick with it while the roads are being built.
Exactly. And all I can say is always question a no. Well, who can I talk to next to learn more about why I'm being told no? Who has this information? How can I be put in touch with them? I am going to speak a little specifically about the type of Medicare plan that I have without getting into the whole bureaucracy of Medicare, because I think it's pretty important to speak on my specific. I have something called a Medicare Advantage plan. I've had it since I have been on Medicare with different providers, but they always require a prior authorization for my Dexcom sensors and transmitters. For anybody, a prior authorization includes four people. And that means four people have to get on board to get, I'm the first, my doctor is the second, the insurance company is the third, and the DME, durable medical equipment, that's where I'm required to buy, is the fourth. So you've got four institutions to deal with to get your needs met when you have a Medicare Advantage plan. So somebody's having a bad day or they're on vacation.
That's true of most commercial plans as well. Now, I mean, I'm on I'm on a Blue Cross commercial plan, and I need a prior auth to sneeze. Pretty much everything outside of basic primary care providers needs a prior authorization. So going into that, like you said, knowing that I'm going to have to get these four people coordinated lets me go in knowing the amount of energy I'm going to have to expend.
And speaking specifically on how I was able to get um, my Medicare Advantage plan to pay for a portion. They didn't set the world on fire, but they did pay a portion of my the fee I was charged. And because IDS was an out of network provider, I had to ask for something called an organization determination, which is a little different than just an out of network referral. An organization determination is something that happens more rapidly than requesting an out of network referral. Once I got that with my plan, I was able to set up an appointment with Alicia and get the information I need. I think we had several appointments. The organization determination gave me X number of appointments during X period of time. And I had to uh, manually submit a reimbursement, a piece of paper, a reimbursement form to my Medicare Advantage plan. And they, in an untimely manner, sent a reimbursement check. The last visit I had, they and I had sent in all of my paperwork as I was supposed to do. I never got a check. Nobody, when I would call, nobody seemed to know what was going on and where my reimbursement form had gone. I lodged a complaint on the Medicare. I don't know if you call it a hotline, but it's a number that you call. You follow all the prompts until you get a real person. And I lodged a complaint. They must respond to your your problem or your complaint. And within a week, I got a response from I don't know what the person's title was within the Medicare system, but she helped me and I got my reimbursement. In all of this, it's just so important to self advocate. And when you're told, well, we need to do an investigation, we that information is not in front of us right now. I say, okay, well, when can I expect? What is the turnaround time for this investigation? What is the next step for me as the consumer to expect here? And yeah, uh, you keep you just keep at it.
Yeah, and to hold them accountable. So to not let it just linger on, to set those dates. Think of yourself as the CEO of me, myself, and I Incorporated. And they've said, well, we don't have those numbers. We'll have to do an investigation. A CEO doesn't say, oh, okay, and then just let that, they say, okay, when is that going to be done? And they say, we'll need 4 business days. Okay, then by the end of the day on this date, you are expected to contact me with a report and agree. Are you going to call me by phone? Are you going to contact me by email? Or am I waiting for a letter in the mail? And that's how that's going to be done. And that way you can keep that ball moving without the onus constantly being on you to have to keep things moving and chasing things and constantly trying to figure out, okay, who, going back to that call prompt of please press 1 for English, um, and get that number, that email of that contact person who's taking point on this investigation, who is my personal contact, who's in charge of this, so that you're reducing the amount of energy expenditure that you have to put in and really putting it on them, because at the top of a corporation is one CEO. That one CEO can't run around doing everyone's job. You have to make sure that they're being held accountable for their job. That's one of the things that I always get really bogged down in, is I say, it's my job to be a person with diabetes. It's my job to be a clinician. It's my job to be a mom. It's my job to be a friend. It's my job to be a daughter. It's my job to my job to my job. I can't also be an insurance rep and a pharmacist and I can't do other people's jobs for them. That's when I get too exhausted. So to hold them accountable, to say, okay, this is your job. How are you going to be held accountable for doing your job? When are we going to contact? How are we going to contact? And who do I reach out to if that contact isn't made? Can really reduce the amount of energy that you're having to put in. And that is one thing that Elizabeth is fantastic at. She is very organized and very dogged in follow through.
I've had two occasions in my diabetes career. As far as I'm concerned, I was discriminated against. I was not, there was no system in place for me to have health insurance for my circumstances as a self-employed person. It did not exist. And that's when I really learned how to advocate for myself. I had an experience where I had to be hospitalized. When I went to the emergency room and they determined what was wrong with me, I had pneumonia. They said, "We're sorry, but we cannot admit you because you don't have health insurance." And I said, "Well, I'm sorry, but I'm not leaving. So I suggest you find whoever can admit me." They came back in about 45 minutes and said, "Well, we're going to let you stay." And so I did. But that's how ruthless it gets sometimes.
That backbone is something that diabetes grows in us sometimes. It's really unfortunate that it has, but
Yeah.
it's unfortunate that we have to get that kind of steel backbone to say, no, this is the line I draw. But on behalf of those who come behind, like you said, you're a long hauler. that you've lived with diabetes for 62 years. Um, I really thank those who have come before me for opening those doors. That it's people who have said, no, I won't be treated this way. It's people who have said, no, you will cover the thing. You will open this door, that then allow those who come next to not have to fight as hard, to maybe not have to fight at all. There are fights that I don't have to fight as a person with diabetes because someone else already fought it for me. And that is another thing, that when I'm getting frustrated and when I'm getting just burnt out on it all, really honestly, I remind myself that every fight I fight is a fight that someone else doesn't have to fight. And that way I don't, the frustration and the fatigue, it helps bolster me a little bit. And I think to people like such as yourselves who have fought fights for me, and I think of the fights that I haven't had to fight. And I say, you know what? I can fight this one because Elizabeth fought one for me. So I'll fight this one for, you know, little Cora, who was just diagnosed. And she's not going to have to fight this fight when she's 20. So,
I would say one thing of importance in dealing with whatever type of insurance you coverage you have is when you run into a situation where you're not getting your needs met, always ask, what parameters does your company have for making an exception so that I can get my needs met?
and that's really good because very often our first instinct is to just get mad and go, this isn't right, that this is a no. But then they're going to get defensive and we're not actually making progress. But to turn that into a question and to say, what are my options?
Exactly.
Where is there space for a question? Who can I talk to who could have additional information? Who's in charge of making this decision, because they might not have all the information and I would like to educate them? What are the additional resources that I can tap into? Because we do live in a very advanced nation that has a lot of supports available.
Exactly. I'm having a remembrance of something that happened during the request for an organization determination so that I could get an appointment uh, and have it reimbursed with IDS. I had someone from the insurance company called me. I had to have a one-on-one with a licensed, I think it was a nurse, but it was a licensed professional, and they had a list of questions. I said, here's where I'm coming from with needing this specialized treatment. Would you want to be using a device that a person that doesn't use it is advising you on how to use it? Do you feel like that's the best way to get your healthcare needs met? Some of the decisions that I have to make in using these devices could have bad consequences. So, speaking with a user is pretty important to me. I feel like I would get the best outcome and in the long run save your company money because I'm not in an emergency room somewhere. My goal is to work with your company to save you money, not cost you money. And and I remember that gal. I'm gonna talk to whoever the next person was to make the decision, and I got a favorable decision.
There we go. Sometimes it really is just getting the message in the right ear. Sometimes it's just that patience to say, I'm going to give the whole message to this person. Okay, you're not the person. This person, okay, that wasn't the person. This person, okay, nope. This person, and it can be very, very frustrating, but to not give into the frustration, to say, I've said this 43 times and no one's listening to me. I always say, sometimes we're talking to the doorman and we're telling the doorman our entire story. And the doorman's like, I'm just here to open the door. And then we go in and we're talking to the desk clerk and we give the desk clerk our entire story. And the desk clerk's like, great, I'm just here to show you the elevator. And then we get to the elevator operator and we give the elevator operator the entire story. And they're like, I just need to know what floor you'd like to go to. And then we finally get to the receptionist and we give the receptionist our entire story. And the receptionist's like, I just asked your birthday. And like, and what we don't realize is we have shared our story with a lot of people who don't actually have the decision making power. And what we needed to do was have go in with the expectation of needing the stamina to share our story in a limited way, probably until we get to the great and powerful Oz, who finally has the ability to actually change something, and then to realize too that like I we have an idea of how decisions are made, and we have this. I was working with a patient last week who had this idea of this like Ally McBeal style courtroom where it was like her and her impassioned plea about what was moral and ethical and right, and then the opponent from the corporation dressed as like the guy from Monopoly, just about the greed and holding on to the money, and the judge in a robe with a curly white wig who was going to make the ultimate right versus wrong decision. And I was like, that's a great concept, but it is not at all what we're dealing with. What we're actually dealing with is contract law and whether what you're seeking is within the contract that you signed. And can we make the wording of what you're asking for something that is within the contract that is agreed to? And when you understand that that's what you're looking for, all of a sudden we can fit a lot of things. I tell patients like if it'll prevent hypoglycemia and you going to the emergency room and costing them $1 bajillion for an emergency room visit, like I could probably get a Maserati covered by insurance if I can find the right way to word it. It's just finding the right way to kind of package it and word it and the right codes and things like that. But I could sit there and all I need is insulin. I can play my violin about how insulin is a basic human right and everyone has the right to live and be healthy, and how my quality of life and how I affect the humans around me, and I could lead a more fulfilling life as a human being and be the greatest my spiritual potential and my self identity, and that none of that matters to contract law because I didn't sign a contract about my potential as a human. So they don't, there's not a code 9251 for great human potential. So, so they don't care.
To sum this up, for help is be able to articulate your needs without having a charge and address, I need some more information here. And how is your company set up for me to find out the information that I need? I try to stay diplomatic, open minded. I try to look at it as let them know I'm trying to stay out of the hospital, okay? That's you go in the hospital and everybody's in trouble. How is your company set up for us to work together for me to get my needs met as a consumer?
A happy, healthy consumer is someone who shows up next year to keep paying their premiums. And that's what they want. And that's what I want. I want to be here to keep paying my premiums next year. So let's all do that. That's a great way of looking at it because we very often see it's kind of us versus them, but to go in and to really facilitate and say, how is your company set up to help me achieve my needs? Because when it comes down to it, we're both looking for the same goal, which is me healthy because me healthy costs you guys less. That's a really great way to go in, and to keep things from getting adversarial, but to also have that backstop and to have that backstop to say we're in this together, we're going to partner, but I'm not going to be pushed backwards. To know that like that hotline is there, that if there's a problem, I have I have the backup at my back. I have this hotline, and you're not going to push me back. I have, for private insurance, there's the Better Business Bureau. I have them at my back. I have larger means that I can refer to. I don't want to. I'm not going to use that as a club. I'm not going to come in immediately saying, well, you're going to give me what I want or else, because that's immediately confrontational. To come in very open and diplomatic and very cooperational, but to also not to be aware that when we then get pushed back, to know exactly how far back we're going to fall and no further.
And educate yourself. Know what you're talking about. Worst case scenario is, I'm fairly certain on this, that each state in our country has an insurance commissioner. And none of these companies want to be reported to an oversight committee. Uh, and I've never had to utilize such as that. There's always something in place. If it's congressman or state legislator, and in contacting these people, if you feel like you need to, ask, say, I'd like to hear from you. I contacted my congresspeople at the beginning of the year because I had to get some Dexcom sensors, and it was the four people show with the prior authorization. There was a glitch somewhere, somebody was out of the office, or and I wrote these people and I said, I've been doing this for 62 years. I work really hard at being healthy. What are you doing?
A lot of things that come out of the diabetes community, because we are a very unified and vocal community, we are able to very much point at national issues in healthcare and get our representatives to really see them and take them quite seriously. And so we do have a very strong voice. And I always advocate for our community to use that, um, and reaching out to your local representatives at the state and the federal level. Don't disqualify your state level, because insurance coverage is legislated at the state level, and those state representatives are much more reachable. They're than reaching for your senator at the national level. Your state congressman, your state representatives are much more communication. They're going to, and they're much more swayed, because one person and the 8 people that they know are going to impact their voting population a lot more. I've had patients reach out and get word from their state representatives and then send that email through to their insurance company or to their device manufacturer, to their insurance manager, and all of a sudden what they were asking for was yeses and red carpets. because they sent a couple emails and got favorable feedback. Yeah, areas of prior authorizations, insurance companies, how they do them, how many they're sending, what medications they're requiring them for, and things like that is very much under observation right now. And we're probably going to see some change in the next, hopefully in the next few years, if not over the next 8 for sure, in how insurance companies do business in that way. Elizabeth, I wanted to really thank you in sharing your perspective and some really great info.
A word from our sponsor. Byram Healthcare understands that managing diabetes isn't one size fits all. With a full range of CGMs, insulin pumps, and diabetes supplies from top brands, Byram makes it easy to get what you need, hassle-free, shipped right to your door. And Byram's team of experts helps navigate insurance so you can focus on living your best life. Ready for better diabetes care? Visit byramhealthcare.com/podcast or call 866-692-8024 and select option 3. And now, back to our program.
So I'd like to leave everyone with some really good tips for turning a no into a yes. The first thing to remember is no is always the first answer. So as a parent, we always joke that like maybe probably means no. So I'm just delaying the inevitable. In the insurance world, no is the go-to answer because you're asking someone to spend money. So their easy answer is no. And very often it's just a hope that you'll go away and not ask again. So just going through the effort of doing the prior authorization, just doing the effort of the appeal, very often turns a no into a yes. So just not taking no for an answer. Beyond that, we really need to go in with a mindset of setting out on a journey, that we're putting in an effort. And so when we do that, no one would set out on a journey and say, okay, this is going to be quick and easy, so I'm just going to make this phone call and expect it to be done. If I'm going to set out on a journey, I make sure that I budget my time and my energy for the effort that the journey is going to take so that I can do it well, so that I don't get a third of the way through, hurt myself, have to call for an extraction and have a terrible time, right? I want to get to the end. I want to have a beautiful journey. So I need to do the same thing when I'm working with my insurance company. So a few tips. First, I set aside weekly time on my calendar for dealing with health insurance related stuff. What we don't want to do is every time something pops up in the mail, we immediately open it, read it, and deal with it, because that is an emotional hit. Every time. It's the explanation of benefits and we look and we go, how much? Or it's the coverage denial, or it's the prescription. It's a hit every time. And sometimes you get a denial and then 2 days later you get an approval. And so you had the emotional upheaval of the denial that you didn't even have to go through. So set aside a time, whether it's weekly, whether it's every other week. If you're in the middle of dealing with something like we heard from Elizabeth, you're going to have multiple communication points that you're having to coordinate. So you might want to make sure you're setting it weekly so that you can handle and communicate with all of those communication points in a timely way. If you're not dealing with something really in the moment, maybe a little further apart. But so setting aside a time, and that way take all of that communication, all of those things, and chunk them all together. Read all of the things because they might all interweave and have to do with one another. They might counteract one another. They might layer on top of one another and influence one another. You might be making one call that covers 3 or 4 different things. So you can really combine your effort and reduce the number of calls and interactions you have to have. And you're going to reduce the emotional toll. Instead of it spreading and bleeding out through your entire week, it's going to condense and just take this budgeted amount of time. Get organized, have your contacts, have a calendar. So we're going to hold everyone accountable, right? We're going to be like our own little CEO here of My Health Enterprises. And we're going to have my contacts list, my calendar of who's responsible for what, who's going to get back in touch with who, when, who's doing what job, who is responsible for talking to whom, Who is responsible for the prior auths? Who is responsible for durable medical? Who is responsible for pharmacy? Who's responsible for sending the orders? Who's responsible for sending the notes? What's everybody's fax number? Who communicates through email? Who communicates through portal? Who communicates through phone? It's a lot. So having one space where that's all written down keeps you organized, keeps you on track. I have just one folder. In that folder is a printed out calendar and a sheet of paper. It has everybody's contacts. The calendar has all of those dates, and all of the paperwork having to do with that, with my health insurance and all that, goes in that folder. And so when something, my Tuesday, for me, it's Tuesday afternoon. It's Tuesday afternoon. Okay, I'm going to deal with health insurance stuff. Where's my green folder? And I pull it out. Something hits the skids, something's going crazy. I get an email, a phone call, if something's not working. Where's my green folder? And I can lay hands on it. And also on that folder, I wrote my reasons why. Keep your reasons why in mind. And for me, I keep them visually. Everybody has a different reason why. Are you going to all this effort to get something that you need to stay alive? That's a very powerful reason why. My health, my safety. Is it to save money? Write down the amount of money that you're going to save with all this effort. That's your paycheck that you're getting. So when you're 6 hours in, you go, yeah, this is taking 6 hours, but it's going to save me $847 this year. That's a pretty good paycheck. It's still worth it. Now, if I'm 8 hours in to save $14, it's time to bail on this project. That is not worth that money. So I can keep that in mind. Is it for the cause? Is it like because it's the right thing to do, because I have been discriminated against or something like that, and it's a passion point for me? Is it for the future? I am doing this now. I'm making this effort now so I don't have to make it next year, because right now I have the time and the energy. Next year is going to be a time in life when I'm not going to have that time and energy. So I'm going to put it in now. That's also a point that I always remind myself. Is it worth putting in the time and effort? I better make sure I'm going to have the same insurance company. So if it's a low value, so if I'm not getting the money, if it's not for my health, if it's not a passion, and I might not have the same insurance company next year, I might not fight this fight unless I'm going to have the same insurance company for multiple years, because that's going to raise the value, because then I'm not going to have to fight it over and over. So I'm going to get myself organized. I'm going to budget my energy, and then I'm going to know my needs. So I'm a single mom. I need to make sure that my son is occupied, that he's not underfoot. Mom. So like, is it a Tuesday night where he has a practice and I can drop him off for an hour and have a dedicated time? Do I have a movie or an activity that I can set him up with? Or do I need to call a sitter and make sure that he's covered? Yeah. Do we really struggle with confrontation? I have a friend who is terrible. When somebody tells her no, her pushing back is the hardest thing in the world for her. So she'll reach out, and she has people that will either cheerlead for her or hold her accountable and say, no, you're not allowed to dodge it. You need to do this. It's hard, but you need to do this. Sometimes she'll call her therapist and say, okay, the thing I need to work on is making this call to my insurance company because it's hard for me. Do you have ADHD? Is just the whole getting organized and budgeting time the struggle? That executive function piece is going to be really hard for you. Knowing that, and having an assistant, have someone in your life. Hire somebody if it's worth it. I have literally told people, hire an executive assistant, hire a secretary. This is a thing you can do in this world. You can hire people to help you out for an hour a week, for 4 hours a month, for whatever you need to help you take care of this piece of your life. Mind blowing, but you don't have to be an actual CEO to hire an assistant. So identify your needs and then find that way to meet that need. Next is, what can we do to, like, specifically, okay, we've set ourselves up for success. We're now weighing into the insurance world. We're approaching the gates, right? So we are going to keep some things in mind. We are going to avoid you statements. Remember, the person you are talking to on the phone is not the CEO of United Healthcare. They're just the person on the phone. They, keep in mind, if they tell you you're right, I agree with you, they could get fired. They have literally been told that they're not allowed to say and do certain things. So when you get frustrated because you're like, just tell me this thing that I need, it is a very simple thing. They're literally, per their job, not allowed. So, for example, they're saying, we can't cover this because you don't have the right diagnosis code. And you go, okay, then what's the right diagnosis code? And they say, we don't have it. And you say, but if that's the wrong one, then logically there's a right one and you should be able to tell me that. And they say, that is logical, but I still don't have that information. And you're ready to bang your head on the wall. They just can't give out the codes. You, on the other hand, can go online. Here's a buzz word, a thing worth writing down and knowing. ICD-10. It's called the ICD-10 codes. Every diagnosis that we have in the United States in medical and mental health care has a code number. There are multiple for diabetes, type 1, type 2, controlled, uncontrolled, with hyperglycemia, with hypoglycemia, with hypoglycemia unawareness, with complications, without complications, on and on and on. So your doctor may have put type 1 controlled without complication. Well, in the insurance world, someone with type 1 diabetes that is well controlled and no complications doesn't need any further support or management help because you're doing perfectly well. That kind of makes sense from their standpoint. So what you might need to do is go to your doctor and say, okay, can we send this with a code for hypo unawareness? Or can we get this supply, instead of running it for a code for type 1 diabetes, can we get it for contact dermatitis? It's something that it's not even a code for diabetes. Or can I get this under a code for mental health? So maybe my diabetes education hours have all been used up, but maybe I have insurance coverage for mental health care, and maybe I get an hour a month for that. Maybe instead of diabetes self-management, you can get it under medical nutrition therapy. So you might be talking to a nurse, but we're talking about insulin timing and food. That now becomes medical nutrition therapy. We're talking about diabetes and how it and stress or exercise. Well, that now becomes mental health education as well. Maybe we're talking about, a woman and how diabetes is going to, or your hormone levels are going to influence. Sometimes it feels like an infection, or maybe there's an infection. And so now we're talking about women's health. So now we're talking about reproductive health education. So we can start pulling from a lot of different places with different code numbers. So keeping that in mind, that those code numbers can open up a lot more doors, but we need to know what they are and what they mean. And your insurance company is not going to be the way you find that out, but you can just Google the ICD-10 and pull those up yourself. And often we can get very creative and we can suggest them to our doctors, where our doctor just doesn't have time for that creative thinking. They just click the first one that is the easiest to click in their computer, and that's what generates and gets sent. So that's one way to turn a no into a yes. The next one, especially when working with advanced care, like us here at Integrated Diabetes Services, we don't bill directly to insurance. So you're going to be doing the work of then communicating with your insurance company and saying, here are the services I'm getting and here's why I need them. Out-of-network care is a big one. As people with type 1 diabetes, we have a rare disease, which means that our care is not always going to be available locally. I live in a very metro heavy medical research dense area. It is still extraordinarily hard for me to get in to see an endocrinologist, even harder for me to get into one who has knowledgeable educators in type 1 diabetes. Almost impossible for me to find one that then also understands my other medical needs and my other endocrine needs. So the level of care that I need is not in my area. And that's with major medical centers and teaching hospitals and research hospitals and diabetes centers within an hour drive of my house. A lot of you live in the middle of America where it takes you hours just to reach your endocrinologist. I have patients in Alaska who take a plane to see their PCP. So letting your insurance company know, I need to see an out-of-network doctor, an out-of-network educator, and here's why. Here are some really good ones. Number one, specialized care. We have, for example, exercise physiologists who are CDEs. The vast majority of diabetes practices don't have that. So if you are a patient who is an athlete That is specialized care that you need that you can't get elsewhere. If you are a patient with a movement disorder or a movement limitation in any way, again, that exercise physiologist is going to be able to work with that specialized struggle in a way that most diabetes educators are not going to be knowledgeable in working with you. I'm a BCADM, board certified in advanced diabetes management. That alone makes me pretty rare. So if you have other diagnoses, other medical issues that impact your blood sugar or vice versa, which is pretty much all of them, really, but especially if they're more complicated issues, just putting that you need to see someone board certified in advanced diabetes management because of your comorbidities. That's going to allow a no to turn into a yes. Spectrum of ages. If you're a young adult, you've likely fallen into a bit of a care gap where you're aging out of a pediatric practice, but not getting the level of care that you need in a standard adult care setting. You need more interaction, more communication and oversight than they're able to provide you for safety, for continued wellness, for the dynamic change of your life. You know, you're changing from classes to sports to work and meanwhile you only see your endocrinologist 2 or 3 times a year. That's not going to be effective. Also, you might be going to school in one state, your endocrinologist might be in a whole other state, and you literally just lack the capacity to go physically see them. Working with a telemedicine practice like IDS fills that need for you. And if you're a parent, you might have a very young child, and the endocrine practices, the diabetes practitioners near you just don't have experience working with a very young child, working with a breastfeeding child, working with children with nutritional needs or with other diagnoses where IDS does. If you're in an advanced age, let's face it, there are a lot of doctors who just don't have experience in gerontology and type 1 diabetes. They don't have patients who have had 50, 60, 70 years of life with type 1. They just haven't been in practice long enough to see them. We have oodles of practice there. So the kind of spectrum of ages, never an issue here at IDS. Mental health support, again, an area specialized for type 1 diabetes that we have at IDS that other clinics aren't going to have. If your biggest barriers in your diabetes care are tied to anxiety, tied to stress, tied to depression, tied to substance abuse, tied to PTSD or trauma, interwoven with your diabetes management, or you're a caretaker of someone with type 1 diabetes and it's interwoven into their management, it's critical that you be able to address those issues with someone who is a CDE and trained in diabetes, and having that care be coordinated is going to be really important. Expert level tech. There are a lot of us whose support at our local level does not understand how to use our technology. I hear from patients all the time that their clinician just told them that their pump does something or works in a way that it does not do. So even just documenting that and saying, I can't work with my local clinician because they misinformed me as to how my technology works. I need to work with someone who actually understands it. Or just saying, I use my technology at a level higher than the education level of my locally available clinicians, of my locally available supports. I need more expert level support. And so I need to be able to go out of network to find that. Do-it-yourself systems are a great example of this. Here's a tricky bit. If you tell your insurance company, oh, well, I use a non-FDA approved system, whoa, right there, they're going to go, well, then we're just not covering any of that. So I wouldn't reveal that, but you can say the technology that I use to manage my diabetes is technology that my clinical supports are not versed in, or that they do not work with, or that they do not support. You don't have to reveal to them what you're using. You can leave that unsaid, but I would not weigh in and say, I am using Trio, and because they're immediately going to say, well, Trio is not FDA approved, so there's your problem. So better left some things unsaid. Distance and scheduling. So if traveling to see your clinical staff is problematic for your life, and it doesn't even have to be that they're hours and hours and hours away. If you have to pack up your 3 kids and take them with you to get there, that is a significant burden on your life, or you have to arrange and pay oodles of money for childcare in order to see your clinician because they don't have hours when your children are in school and in care. That's a significant burden. So being able to document those burdens and submit that and say, therefore, I have a need for advanced care that offers a telehealth option, that offers hours that are broader. We have a clinician who's available on Saturdays. We have a clinician whose my hours start at 7:30 a.m. East Coast time. So if you're on the West Coast, I'll see you at 4:30 in the morning if you're crazy. We have clinicians that are on Mountain Time who practice until like 7 p.m. That's going to be 9 p.m. East Coast time. So we have really, really broad hours. I work with patients in Australia and Taiwan and all around the world. So we make it work. So that's going to open that up. And then scheduling availability. Again, I work in a very metropolitan area, relatively large number of endocrinologists and clinics available, and I still have to wait 4 months for a patient appointment. I have to wait 6 months for a new patient appointment. That's not acceptable. Again, for a young adult with things changing, for someone with a new diagnosis, for someone with a cancer diagnosis, pregnancy, there are just tons of reasons why we need more than an every 3 to 6 month tag in with our clinical staff. And again, if you can document that, then you can turn a no into a yes. Another important tip, find out from your insurance company how many hours per year of diabetes education, nutrition therapy, medical nutritional therapy, that's what it is, MNT, medical nutrition therapy hours, and mental health services hours you get per year. And then make sure every time you see anyone who is not your diabetes educator, that they are not touching those hours. Because what doctors will do is they will go through, and every time your PCP says, how's your blood sugar doing? And you say, fine. And they say, okay. They go over and they click a button that says they discussed diabetes management with you. And so it eats 15 minutes off of that time. And so if you're only allotted 4 hours a year, and every time you see a doctor, they're biting away 15 minutes at a time, or a doctor sits down and says, hey, did you hear about Tandem's new insulin pump? Oh yeah, da 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 da. And you have what feels to you like a 25-minute incidental conversation with your doctor, and they now bill a half an hour. You've now lost a massive chunk of your diabetes education time that you could have very specifically allotted to very important diabetes specific useful information. So be very clear with your PCP, with your podiatrist, with your eye doctor, with your dentist, with the other clinicians. Do not touch my diabetes education time. Do not touch my medical nutrition therapy time. Do not touch my mental health hours. Do not touch, because I am allotting those to advanced education that I am pursuing. That way, when your insurance says, yeah, you get 6 hours a year, you know that when you then try to apply and get that reimbursement, they don't send you a check for the hour and 15 minutes that you have left, because everyone else in your medical world has sort of been nibbling away at it all year long. And once you tell your doctor that, they have to put that in your note and they have to follow that. I'm kind of particular about that because they really should not be getting paid to give a professional diabetes educator diabetes education. They're not actually doing it. Then assistance. Know the people when you call your company, like Elizabeth was saying, how can they facilitate you reaching your needs? I love that. Those statements of how can I get my needs met? How can we make this work? So asking, are there diabetes case managers? Every insurance company that I know of has a diabetes or at least a chronic disease case manager or program. That is a person that is on the side of the patient. That is a patient advocate. That is a patient case manager. A case manager's job is making sure that you get your meds, making sure that your referrals happen, make sure that the communication that needs to happen happens. So that organizational piece, again, if you're someone with ADHD or who struggles with cognitive deficits that can make it really hard, to keep all of those balls in the air and keep all of that going, that case manager can be a huge asset. They might work for the insurance company, but their job description is to help the patients, to help the patient outcomes, to help the patients navigate the system, to help the patient get from A to Z. So they're going to look better in their job if they help you get what you need. So they're kind of like an inside man. Use them. Use that help. You've got social services. Your local social services office is going to have insurance navigators. You can reach out to your hospital systems. Your diabetes clinic might have one in-house. Your local hospital has a whole social services department that you can access. Your social services office, like the health department at your local municipality, at the town, county, and state levels. You can reach out kind of all of those different levels. They're going to have Medicare and Medicaid navigators to help you navigate. What kind of coverage should I have? Should I have an Advantage plan like Elizabeth does, or just D coverage or B coverage, or this? Which plan should I have? Which one's going to work best for me? What kind of coverage does it have? What's covered? What isn't? What should be covered that isn't getting covered? How should things be billed? Go through my paperwork with me and explain to me what it all means. Get on this phone call with me and help me get through their doublespeak, because I'm getting confused and they're spinning me in circles and I get really upset really easily and I need somebody to just sit with me and keep me calm. These people can be super, super, super helpful, and your tax dollars pay for them to be there. Make use of them. They're not just for people who are on Medicaid or on welfare or who are low income. I use these people to help me make sense of the ever-changing Medicare world out there, even though I'm not on Medicare. It's an area that I need to be educated. And then having someone behind you. So for Elizabeth, she's in Medicare. Medicare has a hotline that if you're not getting good service, you call that, like, basically Medicare complaint line, and you let them know, and they will get hot on it really quickly. And everyone in medicine and healthcare hates seeing that number, hates getting that voicemail. So they jump on it because nobody wants that dog sniffing up their tree. They just don't want it to happen, because nasty audits follow closely behind that kind of thing. And you don't want to wave that. Don't go in waving a red flag, right? We go in and we give these companies the opportunity to partner with us. That's what we want. But know that you're only going to be pushed back so far for so long. And if they're not keeping up their end of the bargain, if they're not doing what they say they're going to do, if they're not doing things in a timely manner like they agree to, have someone at your back. So is there that hotline that can advocate and partner with you? The Better Business Bureau, again, super, super helpful. I have had to reach for the Better Business Bureau several times in working with my health insurance companies to be an advocate, because what they do is they read the contract, because what we're dealing with is contract law at the base. And they will step in and they will tell that company, this is what your contract says. We've read it. This is what the patient is asking for. According to your contract with them, they should get this, make it happen, or else we're sending this to arbitration. And then the Better Business Bureau will select an arbiter who is basically a court appointed. It's not a judge, it's not a trial, but the arbiter then looks at the decision, and the arbiter then says, this is the decision. And then the company is legally required to do what that arbiter says. Companies do not want to go to arbitration, because if they do, the Better Business Bureau has reports, and anyone can go to the Better Business Bureau and pull up the reports on any company represented by the Better Business Bureau, and their grade goes down. So everybody wants to have an A with the Better Business Bureau. Nobody wants to have a C. So their grade slips, and they get more and more dings against them the more reports they have and the more negative findings they have and the more times they go to arbitration. Much like not wanting to have that auditor from the Medicare advocacy representative, no independent company wants to have the Better Business Bureau knocking on their door telling them that they're in trouble and they're going to be sent to the arbiter. So they will move heaven and earth to suddenly give you what you need. For that reason, documentation is key. So if you go on to an insurance website or an insurance app and something is covered under their formulary at a certain amount or at a certain rate, or you get a certain number of hours, print that out, screenshot that, keep that information. I had a situation where, per the formulary that the company sent me, my insurance was supposed to be $20 a month. And then the insurance company was trying to charge me $80 a month for my copay. And they said, oh, that's the wrong formulary. So it's the one that when I requested a copy of my formulary, this is the one you sent. I have the email where you sent it, and here's the screenshot. I contacted the Better Business Bureau, and by the time the Better Business Bureau contacted the company, they had gone in and changed the website that I had screenshot. So the Better Business Bureau said their website says $80. I said, funny thing that, here's the screenshot dated from the day that they sent it to me. And here's the email from when they sent it to me that shows 20. And the Better Business Bureau got very mad at that company. And I got my in for the correct price. The Better Business Bureau required them to back pay me for all of the overcharges because it took me months to realize this was happening. They back paid me for the overages, and they had a disciplinary measure taken against them because they went in and edited their formulary specifically to try to hide it from the Better Business Bureau, which is a big no-no. You don't go in and edit documentation to hide what you've done. So they got in some trouble, which I can't say it didn't feel really, really good. So make sure that you keep your documentation in line. So again, my little green folder, and I have a little folder on my phone, and I keep it really nice. Oversigning is another thing that can be really helpful. We have a lot of nurses in our lives, but what allows billing is often called an NPI number. That's a prescribing paying, it's a payer code, basically. So we've got a diagnosis code, we've got a service code, we've got a payer code. And all of these magical codes all need to synergize together to get through the lock that is going to allow an insurance company to pay for something or reimburse for something. Problem comes up that, for example, Medicare will not allow billing for an RN. I can't get a Medicare billing number. I can't get an NPI number. So typically what happens is when an RN, such as myself, provides care, I provide that care under the umbrella NPI of the facility or organization under which I am employed. So for example, I work at Integrated Diabetes. Integrated Diabetes is owned by Gary Shiner, who has an NPI number. And so my services are entered under his NPI number, but it goes to the insurance company and they say, well, this isn't Alicia Downs's NPI number, and all of the notes that you submitted to show that you got all this great education all have Alicia Downs on them. So we're not going to pay because the two don't match. We can do what's called oversigning. So because we collaborate here, we do weekly clinical collaboration meetings where we discuss patients, patient needs, clinician needs. We basically all put our brains together and try and work together, and we collaborate in between just constantly. It's how we work. It's how all health systems should work. We also have RDs, registered dietitians. Registered dietitians can get an NPI number, just we RNs are stuck. So because we all work very collaboratively, we can have, for example, Gary oversign notes on what I've done. He can look and say, yeah, Alicia did what Alicia should do, sign off on that. And now it can bill through his NPI number. Likewise, Jenny has an NPI number. Dana has an NPI number. Just poor Tavia and I are left out in the cold with no NPI numbers. Also, our therapists fall in a funky interstate weird place for billing and reimbursement. We'll probably have one of them do their own podcast because a lot of that does fall into a weird in-between zone depending on what state you're in and things like that. But I and Tavia both hold what's called a nursing compact license, which I think as of today, about 50 states. So 43 states and Puerto Rico all recognize my nursing license for both practice legally and for billing. So we have very wide coverage. So I hope with all of that, I've given you guys a lot of info today and a lot of inspiration on how to turn our insurance no's into yeses. It is a tough battle. I always say, again, type 1 diabetes is not the hard part of managing my life with diabetes. It's really the burden that I carry when I'm working with my insurance companies to get things approved, to get prior auths through, to do all of the double, triple, quadruple work. A lot of it's because it feels so unjust. And that's very hard on our hearts and on our spirits to have to fight so hard for something that feels so unjust. And that's where I really try to reframe that And I say, I'm not fighting against injustice. I'm fighting for, like Elizabeth, who's spent 60 years fighting for amazing things. So now I don't have to. There are so many fights I don't have to because someone else fought them already. Now it's my turn. So instead of getting so bogged down, I I take that on as sort of my mantle. Now it's my turn to step up to the plate and be the diabetes champion, and to be someone else's Elizabeth, to step up and fight the good fight so that the newly diagnosed, those coming up behind me, can live, worry a little less worried, a little less stressed, maybe not have a green folder, and get to enjoy a little bit more of the time in between the efforts. So hopefully some of the things that I've learned and picked up can help you, and also help you remove a barrier to care here at IDS. If insurance is a barrier for you, again, that's a big part of what I do. It's a big part of my specialty here at IDS. Feel free to reach out to me. Feel free to schedule a consult, even if it's just to work through your insurance struggles or to get some tips and pointers and suggestions. Also, if your financial place, if you feel like these tips, great, I still feel like it might be a pinch point for me, please reach out to our office. We really love our community and we don't want the financial burden to be your primary barrier. So whether it's the financial piece, whether it's the insurance piece, please reach out, and our admin staff will walk you through options and how we can come alongside and be of additional help. So thanks so much for joining us. It's been really great to be able to share some of what I've learned through my struggles and my efforts.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. Think Like a Pancreas, the podcast is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.